In this our CBME session, myself Dr. Pragnesh Parmar will take a topic on the logbook and certification of skill. Logbook and certification of skill. This topic is very important because in forensic medicine, all of us has to create a logbook and all of us has to certify the certain skills as per our need and the suggestions given by the MCI. So without wasting much time, we will begin the topic. So what is the objective of this session? So at the end of the session, every one of us will be able to develop a logbook that will allow the student, teacher and institute to document the acquisition of predetermined competency. As we know, current curriculum is competency based curriculum, and competency is the key word. Once this word is introduced, everything has been changed. We have to modify our teaching learning method, we have to modify our assessment method. In the same way, now we have to certify the competency, and we have to decide either the student has acquired such competency or not, and that also we have to document. And to document we require a logbook. So logbook will benefit student, teacher as well as the institute, and it is must as per the MCI or NMC norms. It is must to develop a logbook, so it is compulsory. Now before starting the actual session, let's go through certain terminology which is given in the NMC module of the logbook. Now this entire presentation is based on the logbook module given by the NMC, as well as some part from the skill module, some part from the assessment module, and resource material provided by the nodal center. So this entire presentation is based on that material. So let's first start with the terminology competency. Now in this entire 10 years, we can say duration when the curriculum reform start, this word is magical word, competency. This competency word when introduced in the curriculum, everything started rolling and changing. We have to change our curriculum. Initially the big modules came, and in detail structured curriculum came out. Then various exhaustive module also came out, till many modules are coming up. So competency is very important word. So let's see the definition of competency, and I am sure in previous session also you encounter this word and definitions. So competency is nothing but the habitual and judicious use of knowledge, technical skills, communication, clinical reasoning, emotions, value and reflection in daily practice for the benefit of the individual and community being served. So now see, so many words they have imparted or imbibed in the competency. Knowledge we are always focusing since long. We are giving knowledge to the student as far as possible from the textbook and from the practical scenario also. Skill also we are teaching to the student far or less as far as possible. Clinical reasoning also, sometimes we are framing questions, asking them reasoning questions. So this is good. Knowledge, skill, reasoning we are teaching to the student as well as we are assessing also in current scenario. But communication, emotions, value, reflections, these are new terminology and new word that we are neither dedicatedly teaching, neither we are dedicatedly assessing, neither we are dedicatedly documenting. Now MCI or NMC is focusing on these words also: communication, emotions, value, reflection, and it is not that much easy to teach, neither it is that much easy to assess for teacher as well as student both. So we will try to learn all these things over a period of time. It is not a one night or one day show that we can learn everything. We also teacher become trained and student also acquire everything, but over a period of time, as the curriculum has already been rolled out, over a period of time both the side people will improve. So let's see the logbook. What is logbook? Logbook is nothing but a verified record. So we have to verify. It is a verified record of the progression of the learner, documenting the acquisition of the requisite knowledge, skill, attitude, and competency. So whatever the knowledge, skill, attitude, and competency learner has acquired, as a teacher, we have to document it and verify it. So it is a verified written record. It is nothing like oral. It is on paper, black and white. So it is a verified record. So we have to be very careful when we are signing something in forensic medicine. We are telling before signing, see or read 2 times. So same apply here. Before certifying anything to the students, we have to see either the student is really competent or not. Now second terminology is portfolio. Portfolio is a collection of learners' progression in the task and competencies. A portfolio is an evidence of events documented in the logbook. It includes the assignments or self-assessment exercise, feedback, workplace-based assessment, formative assessment, reflections, any planned activity which is done as a part of curriculum. Everything will be comes under portfolio. So if we see in debate, portfolio means evidence of events. So in logbook, it is just on paper, black and white. There is no evidence we are attaching. But in portfolio, evidence should be there. Suppose in the logbook, we are certifying the student has attended quiz. In portfolio, certificate of quiz or photograph of the quiz will come. So evidence of that task will come in portfolio. Suppose student has done self-directed learning, then just topic name will come in the logbook. But some photograph is there, some content is there. It may come in the portfolio. Same way student has some project, then in logbook just title of the project, duration, signature of the faculty will come. But if we see portfolio, then it may have structured abscess we can add or something we can add, which has some evidence. So logbook are thus linked to the portfolio and may be included in the portfolio. So we can say portfolio is a bigger picture and logbook is just a part of it. Portfolio is big in nature and difficult also sometimes. For student also difficult to prepare and sometimes for teacher also difficult to assess because it may become sometimes voluminous. So what MCI or NMC say, as per GMER, logbook is mandatory. So each and every forensic medicine department of every college has to maintain the logbook. Logbook is mandatory and individual to the student. Portfolio is optional. Usually over on the portfolio because at present it is just optional. So I don't think so. Most of the institute will directly jump on portfolio. But let's first begin with the logbook as it is mandatory. Now let's see other terminology given in the module of logbook. Now activity. Activity is the term refers to the predefined task performed by learner that contribute to the achievement of stated objective or competency. Now we all know MCI has given various competency in the subject of forensic medicine. To achieve this competency, we have to frame specific learning objectives that we already have framed. Many of the institute have already prepared the essays. Now for particular performing task or shows how task, how to achieve these objectives, again we have to divide them into various tasks, that is activity. So competency, multiple objective make competency, and activity, multiple activity may lead to a objective, or sometimes one activity may lead to a objective. So it varies, it depends upon the competency, depends upon the objectives. So activity is very important that we have to structure. We will see one by one in the future presentation that how it is possible. Now second terminology is remedial. Remedial is again a planned activity which aim to correct the deficit which prevent the learner from achieving the intended outcome. Whenever we are seeing that some are slow learner, they are not understanding how to prepare medical legal report or any certificate writing, we have to take some plan activity to correct the deficit in that particular student. That is remedial measure. We may have to teach him separately, or sometimes we have to take additional session, or sometimes we have to give proper feedback, proper guidance how we can improve before certifying that person is competent. So these are remedial measures that also now we have to start as a faculty. And third one important is a feedback. Till now in medical education, feedback was neglected part, but now MCI or NMC is so much focusing on the feedback. So feedback is nothing but a formal and active interaction. It should be active, perform at the completion of observed activity. So once we perform some activity, then after immediately we have to give formal and active feedback so the student can immediately improve. Which is the aim of the feedback is to facilitate the positive change, growth and improvement of the learner through the guided reflection of activity performed. So the intention of feedback is the person or student can improve, some positive change occur in the student, person can grow and develop in the particular competency. That's why feedback is very much important. So these are the terminology we will keep in our mind, like what is competency, what is logbook, portfolio, activity, remedial, feedback. All these are very important. Now we will see the actual content. What should be the content of logbook? Logbook must have one logbook certificate, like our routine journal is there. We are in front page certificate is there. This student show and show name, age, has successfully completed this journal or logbook, and finally the signature of the head of the department. Same way, brief biodata of the student can be mentioned. General instruction can be given in the logbook how student has to follow entire 2 years. Now we have two phase, second phase and third phase. So how the student has to plan and everything, we can give proper instruction. Subject pattern and certain rules which is laid down by NMC as well as your particular own university can also be laid down in the logbook. Now all the competency, if you want to reprint it in the logbook, you can, otherwise not, then also you can provide link or resource material, there is no problem. But certain things should be mentioned in the logbook, like exam pattern, how to calculate internal marks. This should be done. MCI is not stated clearly what to write in the logbook, but these are certain basic suggestions. Then whatever the self-directed learning made by the student can be documented in the logbook. Like we can have one table, 2-3 pages, or 1 page of self-directed learning in which serial number, what is the topic of self-directed learning, on which date student has done, signature of the faculty. Like this you can do. Same way seminar, serial number, topic of the seminar, which date student is presented, and signature of faculty. Like this, various pages we can add. Like project, if we are planning to give any project to the student in forensic medicine, same we can add serial number, title of the project, duration of the project, either it is completed, published, whatever we can certify it. Quiz, if the students have attended any quiz, regional quiz, state level quiz, national levels quiz, either they won any certificate or medal or memento, that can be documented. Reflections, now reflection is very important. Student has to reflect sometime after the practical is over or teaching session is over. There are various format in which reflection can be written. So first we have to train the students regarding that, and then students can write on its own, like what was done, how it can be better, what is the most important part student like from that practical point of view, which is the best moment in that. Like this reflection student can write. Now again, it is very difficult most of the time, even for faculty it is also difficult to write reflection. Now for student also it will be, I think, somewhat difficult to write reflection. Second thing, even though student is writing, either faculty is going to assess or not, because we have to also give time to see either student has written what in reflection, if any negative point is coming up we can also rectify. So all this thing is not that much easy. And most important part, sometimes copying, student may copy from other student. Even as faculty, many of the time we are also looking that if we get some ready-made or printed material like logbook, we should not do any hard work, we can just directly copy. So same mentality student also. Student also see if some ranker has written reflection, let's copy it, and every batch all the student will do the same thing. So all these things we have to be vigilant. Now whatever the adcom competency or foundation course competency, that also we have to mention in the logbook, because both adcom and foundation, that is also very important in the eyes of MCI. Now attendance record, regular attendance, as well as we, if we have taken any extra class or remedial measures, that also attendance record we can mention phase wise. And record of internal assessment in first exam, second exam, third exam, preliminary exam, or any additional exam has been taken, whatever is the score of the student, and everything should be documented. So student also has one written record, and it will be on paper. So it will be good for student as well as institute as well as the teacher. Now successful documentation and submission of logbook is must for final summative examination. This is clearly written in the NMC. A successful documentation and submission of logbook is must. It is a criteria to appear for the final university examination. If the student is not writing the logbook, or student is not submitting it, or if the student is not getting certified certain important skills, then student cannot appear in the university examination. So logbook is tremendous important, and it's again on institute and faculty how we are giving importance to them. If suppose we will give the same attitude like our current journal, the students are copying from seniors, then logbook will also go in the same direction. So it is on faculty that we have to be vigilant. We will try to take care that each and every student will get competent in certain skills. So again, all this thing depends upon faculty and institute, how strict and vigilant institute and faculty will be. Otherwise, if we see in current scenario, most of the students are copying journals or record from the seniors or from past record. And if we can see some mistakes are coming from past, it is continuing. So same can occur in the logbook. So that also we have to be very careful. Now in the logbook, there should be separate pages for AdCom and foundation course. So whatever the AdCom module going to be conducted by forensic medicine department at your institute, that you need to be add. And same way in foundation course, if you are going to do anything, then you have to add that in that foundation course logbook. Now logbook can be prepared either subject wise or phase wise. Now as per my opinion, it is better to prepare subject wise in forensic medicine, because we have subject in two phase. If we prepare phase wise, then in second phase the logbook will be different, and in third part one logbook will be different. So student has to maintain two logbook in forensic medicine if we prepare phase wise. So better do subject wise, so only one logbook for one student in entire 2 year. And we can also, MCI is given liberty, either it may be print or electronic format. Now those institute which has a facility or various learning management softwares and everything, they can go for electronic format. But most of the government or many of the institute are still not have that much facility, dedicated software and dedicated learning management system. So mostly it will remain print format. Now let's see the process of certification of competency. Now these 5 points are very important. First one is the what are the competency that need a log. So this is the primary important question. Which competency we will put in a logbook and we have to certify it. Second question, what are the activities that will lead to acquisition of competence? How we can draft the activity by which we can ascertain the student has completed that competence. What is the level of achievement that determines successful completion of activity? How we can judge the student is successful in determining that completion of activity. Then fourth one is what needs to be done if level is not achieved. If some student is fail in first attempt or second attempt, what to do? And last one is how do we document this acquisition. So all these are very important 5 points. So now in presentation we will discuss one by one each and everything which is given in the module suggested by the NMC. Now let's see the first question. What are the competencies that need a log? All the competencies that are at perform level, P level of competency, it require log. So again we have to see in our subject forensic medicine competency which competency are particularly P level, perform level. And selected asset shows out competency at psychomotor or communication domain. That also we need to certify in the logbook. So two things we need to keep in mind. One is the P and second one is selected asset. Now if we see the curriculum given by the MCI is given, competency number is given, competency title is given, then MCI is suggested P or SH. Now that is suggestions given by MCI. As per the institutional need, as per the departmental need, we can judge which competency we will exactly enter in the logbook. But keep in mind P and selected SH competency we can add. Now what other thing we need to add in the logbook? Self-directed learning, reflections, narratives, creative writing. Now all these things students are not doing routinely. As I already told, reflections, narratives, narrative on some topic, creative writing, this student is not at all doing. And we also never tried, neither student have taken any initiative. Whatever group activity student has done like presentation in seminar, symposia, etc. should be noted down in the logbook. Then any specific clinical or laboratory experiences, community experiences or project, field visit if we are taking our students to the courtroom or forensic science laboratory or any other outdoor visit, that also we can document in the logbook and we can certify to the students. But all these things again we have to see how much it is feasible. Now second thing, knows and knows how competency, best avoided unless a clear documentation is warranted. Don't include knows and knows how competency in the logbook, otherwise logbook becomes so much voluminous and our workload will increase, and it is not at all required, also not desirable. Only perform and selected shows out, not all the shows out. Now let's see from our curriculum, forensic medicine curriculum, which are the perform competency. Only one competency is there which MCI suggested P, and it is also suggested shows out. So either we have to decide either it is perform individually or it is just shows out. So it is FM 14.1, examine and prepare medical legal report of an injured person with different etiologies in a simulated or supervised environment. So in short, it is like an injury certificate. Student has to prepare. Either we can give some scenario case based, we can give photograph, we can give some simulated patient, or we can give mannequin, whatever. Some material we can provide, or even hypothetical, as many of the institute are doing hypothetical injury report writing. So this is at perform level as shows how level. So this we must document in the logbook. Now various again shows how competency. FM 1.11 it is shows how write a correct cause of death certificate as per the ICD-10 document. So again this we can document in the logbook. 2.29 competency. Demonstrate respect to the directions of court while appearing as a witness for recording of evidence under oath or affirmation. Examination in chief, cross examination, re-examination, court question, recording of evidence. So all these competency they have given as a shows how. So we can plan some moot court or like this activity and we can document it. Now again this competency we have to prepare various SLO. Then we have to plan various activity. which activity we will finally document in the logbook. So that we have to work hard at the departmental level. And our feasibility, now in feasibility everything will come: infrastructure, material, manpower. The age old question in forensic medicine is manpower. So all these things we have to take into account, and then we can plan. 2.35, demonstrate professionalism while conducting autopsy in medico legal situation, interpretation of finding and making inference or opinion, collection, preservation and dispatch of biological or trace evidences. Now this competency 2.35 is shows out as well as knows out, KH. So we have to decide either we want to do it as a shows out or in knows how it is okay. We don't want to document. And now again it is multiple aspect it is covering. So again we have to prepare SLO, various activity, and then finally we have to decide whether we include it or not. Now it is completely on the judgment of department, or you can decide at your university level. MCI is not given in written. These are the competency need to be entered in the logbook in forensic medicine. MCI has just given suggestions. Even in logbook module also MCI has given suggestions. We can do changes as per our need. That you have to decide at your university as well as departmental level. Now again shows our competency 3.32. Demonstrate the professionalism while preparing reports in medico legal situation, interpretation of finding and making inference or opinion, collection, preservation and dispatch of biological or trace evidence. 3.33 again it is shows how or knows how. So we have to decide at which level we have to stop. Should be able to demonstrate the professionalism while dealing with victim of torture and human right violation, sexual assault, psychological consultation, rehabilitation. So these are big terms in competency. Now when we actually want to do it will be difficult, so we can restrict up to knows or knows how. Now 4.29, demonstrate ability to communicate properly with media, public and doctors. Now again it may be knows how or shows how, so we have to decide at which level we have to do. 4.30, demonstrate ability to conduct research in pursuance to guidelines or respect ethics. That also depends. Now again other competencies. 6.3, demonstrate professionalism while sending the biological or trace evidences to FSL, specifying the required tests to be carried out, objectives of preservation of evidence sent for examination, personal discussion on interpretation of findings. So again it is shows how as well as knows how. And one competency cover many domains, means many aspects. So many SLO will come out from that, as well as we have to plan activity. Now 14.2, it is completely shows how. Demonstrate the correct technique of clinical examination in a suspected case of poisoning and prepare medico legal report in a simulated supervised environment. So now this we can add. If we want to give emphasis on poisoning or toxicology part, this can be added in preparation of medico legal report. 14.3, assist and demonstrate the proper technique in collecting, preserving and dispatch of the exhibit in a suspected case of poisoning along with clinical examination. Now this can also be done by arranging some spotting or some exercise, checklist. Everything can be done in this also. So this we can include if we want. Now many more. 14.10, demonstrate the correct technique to perform and identify ABO and RH blood group of a person. Now this laboratory work, I think in most of the forensic medicine department now laboratory work is stopped. No one is now doing ABO blood grouping or RH in the forensic medicine because student has already done in physiology, pathology. So many of the institute, I think the actual laboratory work is gone. Only documentation, medical legal report, PM report, everything is going on. But this actual laboratory work is gone. And now laboratory also now we have to share. Museum also we have to share. So we have to see accordingly and then we can add it. 14.9, demonstrate examination of and present an opinion after examination of skeletal remains. Now this is also shows how at undergraduate level. So again we can here give some bone, ask some reasoning questions and everything, and then we can try to include it because we are routinely doing is it as spotting. So that is same we can include here also. Now these are the integrated competency. This is not actual competency of the forensic medicine. These are the first competency we can see, internal medicine 20.2, which suggested integration with the forensic medicine. Now if the medicine people are not doing, or if they are asking our help, the forensic medicine people can help in this, then we can be ready to help them. So describe, demonstrate in a volunteer or mannequin and educate healthcare worker or patient the correct initial management of patient with a snake bite. So again, actually it is a competency of internal medicine, but integration is suggested with forensic medicine. Same way, 20.4 in internal medicine. Elicit and document and present an appropriate history, circumstance, time, kind of snake, evolution of symptoms in a patient with snake bite. So both are related with the snake bite. Now 21.7. Counsel family member of a patient with suspected poisoning about the clinical and medical legal aspect with empathy. So here more emphasis on communication skill, empathy. So again, if we can contribute, we can help or contribute with the internal medicine department. Now this is related to OG, means obstetrics and gynecology. 9.2. Describe the step and observe or assist in the performance of MTP evacuation. Now here knowledge part we are already teaching in the forensic medicine, MTP Act and everything. But actual observe or assist part can be done in the OBGY department. But knowledge component we can take care of. Now again integrated in OBGY. 20.2. In a simulated environment, administered informed consent to a person wishing to undergo medical termination of pregnancy. Now how to elicit informed consent. So this also knowledge component we are doing, but actual how to do that we can collaborate with the OBGY, or they can approach us. Even in surgery also, demonstrate professionalism and empathy to the patient undergoing surgery. So all these are competency suggested by the MCI in the competency document in the curriculum of forensic medicine. So all the number and competency they have given suggested domain, either it is knows how, shows how, or perform. Now it's upon us how much we need to enter in the logbook and how much is feasible for us to enter in a logbook. Now it is desirable to break down the competency into objectives so that the learning session can be devised accordingly. It is clear that competency we have to frame SLO. In each and every SLO we have to see either theory session is required, practical session is required, we have to do OSCE or OSPI, or we have to do spotting, we have to prepare checklist, we have to score them, or we have to just give generalized scoring. Everything we have to look depending upon the activity or objective we have planned. And then finally we can decide which we can enter in the logbook. Now second question, what are the activities that will lead to acquisition of competency? So the thing is, what should be done by the learner to achieve competency? What learner has to do to achieve the competency? Not all element of competency need to be addressed by single activity. What MCI is telling, multiple session, multiple activity you can do gradually, which require the progressive enhancement of knowledge or skill leading to the acquisition of competency. Now if we see example of injury certificate, first we have to take the theory session. We have to teach them IPC 44, IPC 319, 320. Then we have to teach them classification of injury, all the injury, abrasion, contusion, laceration, incise wound, chop wound, stab wound. So everything we have to teach them first. Then we can take one session in practical or in tutorial regarding injury certificate. What is the format of injury certificate? How to write injury certificate? Then we can give some photograph and ask them to write, or we can give some scenario or simulated patient and ask them to write. So this multiple session is required. Now that much time as a faculty we need to spare. Now again same thing, if the student is not able to do in one session, we ask them to repeat. If it is again failed, again we have to arrange for remedial and everything. So it is, we have to try at our best that whatever we can certify, it should be not hypothetical. The student has already done that activity and then we are certifying. So we can do whatever is possible within the institute. So what are the activities that will lead to acquisition of competency? Let's say this: examine and prepare medical legal report of an injured person. So components of activity: first, teaching session person has to attend. Person must know definition, classification of injury, various injury, IPCs. Then student should attend the practical session on preparation of injury report, which is compulsory. Then student has to prepare injury certificate from given case scenario, photograph, or simulated patient or mannequin, whatever we can provide as per the departmental availability. And finally, person should be able to interpret the given injury, either it is grievous or simple, dangerous weapon, everything whatever is there as per the injury table, that student should be able to interpret. So we can divide activity like this. You can divide on your own whatever is feasible to you, and finally you can document. Now Third question is, what is the level of achievement that determines successful completion of activity? The question is here, when you can say the activity is successfully completed. What is your expectation from the student? Or what is the criteria that meet the expectation? Either scoring is required or not. Either you have prepared checklist, you are planning to teach them according to OSCE, you have already given them the important points. Either they are performing, you are giving scoring, then how much score is required to pass out. Everything you have to decide first. And internal assessment also. In the assessment module, it is written that 20% of internal marks maximum can be given from the logbook. So if we see in the forensic medicine, theory and practical, internal mark is 100. So 20% means we can say 40 mark, maximum 40 out of 200 should be from the logbook. We cannot give more than that mark. So logbook is also very important, which carry the weightage in the internal assessment. An internal assessment, if person is clear, then and then person can appear for university examination. So logbook has two roles. One is weightage in the internal mark, maximum up to 20%. And second thing is, it must be completed to appear in the university examination. So criteria for successful completion of activity in the injury certificate, we are usually in all the competency routinely writing the word accurately. The preparation of injury certificate from given photograph accurately. But what is accurately? That if you want to write down on black and white checklist, or if you want it subjectively, that teacher will assess, that depends upon you and depends upon the activity. Numerical scoring is required or not in injury certificate? I think it is not required. And documentation of activity in portfolio as far as not required right now. So all these things we have to plan before actually starting entering in the logbook. Now what needs to be done if level is not achieved? If the student does not meet the expectation, what to do? First thing, we have to repeat it. We ask the student to write injury certificate again. Again, if he is doing mistake, we can ask again. But if he is not correcting, then we have to teach again, or we have to give some time. We can give him feedback proper. We can, whatever the mistake he is doing, we teach them. In remedial session, we can again check. So these are the only thing we have to do till person become competent. Then and then we can certify it. So recommended action when the learner is unsuccessful is provide feedback. Feedback is very important so that the student can rectify himself. And immediate feedback is very important. Allow repeat. Ask him to repeat unless and until he is successful. Repeat twice. He is unsuccessful, then you can ask him to write multiple times or ask for remedial measures. Clear. And before planning any such activity, we have to arrange for material also. Like mannequin is there, or photograph is there, or weapon is there. That we have to arrange everything, and then we can actually start the activity. Now, how do we document the acquisition of activity in the logbook? Now, for this, in the logbook module, one log table has been given or suggested by the MCI. Now, MCI has already told it is not necessary to exactly follow the same table, but you can have idea from that, and we can modify accordingly. It may be physical or electronic. Now, submission of logbook is a prerequisite for taking final exam. We already discussed, and a portfolio or an annexer of the logbook can be used to support the entries into the logbook. So portfolio we are not touching right now, but in logbook we can try to follow the log table which is suggested by the MCA. Now this is the documentation in the logbook. You can see the first number is competency number, like FM 1.1 or whatever. Then name of the activity, date. Fourth number is the attempt, either first attempt, repeat, or remedial. Fifth number is the numerical score or directly rating, below expectation, meets the expectation, or exceeds the expectation. Sixth number is decision of teacher or preceptor, either the activity is completed, repeat is required, or remedial is required. Then initial, our signature, and either the feedback is given or not, and the signature of the learner or student. So this table is already given in the logbook module. We can follow the same table or we can modify as per our need. It depends upon the institute. So number one is very clear. Just we have to document the competency number. Like in injury report, it is FM 14.1. So just we have to write down FM 14.1. Second one is the name of the activity. So we can write down in short or we can write down entire activity. It depends. Examine and prepare the medical result report of an injured person with different etiology. So here whatever is that we can write down. Prepare injury certificate from given photograph or prepare injury certificate from given scenario. Like this we can document it. Third one is the date, the actual date on which the student is doing that activity. That date we can mention. Now attempt. If the student has only one attempt, then you can write down it is a first attempt. If the student is doing second time, then write down repeat. And if it is remedial activity, then write down remedial, RE. Clear? So these are the already given in the logbook. Now if numerical score, suppose checklist is there, then we have to write down the score. Either it is 5 out of 10 or 6 out of 10 or 9 out of 10. Or otherwise we can directly write down the successful, either it is below expectation, meet the expectation or exceed the expectation. So that we can write down in short B, M or E. Then sixth one, either the activity is completed means it is C, it is over. If it is require repeat, then we have to write down R. So student has to repeat again. And it is remedial, then we have to write down RE. So we will again give feedback, some session and remedial. So clear, repeat activity does not repeat without any further intervention. Person can repeat immediately. But in remedial, we have to give some suggestions, some extra input. Like see this example, FM 14.1 injury certificate, date is today's date, first attempt, meet the expectation, completed. So this thing is over now. So injury certificate from photograph, suppose it is over, completed. But suppose, see the second one, 4.1 injury certificate from photograph, today's date, repeat. Second time student is done and meet the expectation, then it is completed. In first time it is below expectation. That's why repeat has been given and feedback has been given. Second time, repeat time meets the expectation, so completed. If again it is not completed, then we can give remedial. Now remedial meets the expectation, completed. Like this we can complete the certification of activity. Now this is the list given in the acquisition of skill, IMG should have. So at the completion of MBBS course, student must have this many skill, certifiable procedural skill. Who will certify? Again faculty has to certify, forensic medicine faculty. Now for these, either the student is compulsorily coming for internship. No, student is optional. It is not compulsory in current scenario, that if the student want to choose 15 days elective posting in the internship, then student will come to you. And again in that 15 days, we have to give this in certification. In that we can see documentation and certification of trauma. It is I means independently perform on patient. So this we need to teach them independently. Now diagnosis and certification of death, that is D only, demonstration on patients or simulation and performance under supervision of the patient. So that also we have to look after. Legal documentation related to emergency cases, that is also D. Certification of medical legal cases like age estimation, sexual assault. And last one is establishing communication in medical legal cases with police, public health authority and concerned department, etc. So this thing also we need to keep in mind. Now all these things we can't directly certify at a UG level, because it is the skill must be acquired by IMG at the end of completion of the course. Means in the internship we need to certify. Now in internship also, if the student is coming, then and then we can do that in detail, individual perform on patient and everything. And in that also, if we can see in all the department, they are not dealing with the medical legal cases directly, like trauma and everything, and even in private also. So it is again difficult to give or certify everything to the student. So again, depending upon the departmental feasibility and available resources, we can try to do as far as possible. So whatever I have presented here, all the references are from the actually MCI or NMC logbook module, skill module, and the resource material provided by the nodal center regarding this. I actually thank and acknowledge all the faculties of Pramukh Swami Medical College, Karamsad, Gujarat, faculties of GSMC KM Hospital, Mumbai, and faculties of CBME MEU Initiative for giving me this opportunity to present this.